within this slide, hopefully the video will play, but this is the Precision Child Health campaign at SickKids. It's a very nice video, but essentially it features a story of our patient partner for this project, for this study. And this patient partner, the video is inspired by the patient partner whose child was diagnosed with hypertrophic cardiomyopathy, which is the leading cause of sudden death in children and the #1 killer of student athletes. And this individual's child had passed away tragically after suffering a lethal arrhythmia at school when they were playing with their friends. And in this video, which you unfortunately weren't able to see today, but it nicely shows that what could have happened if we were able to intervene earlier and predict this event from happening, predict this event that was going to happen and intervene earlier. And this is the solution that we developed within this program that we're looking to implement with this study. It's a sudden cardiac death risk calculator that predicts the 5-year likelihood of experiencing a sudden cardiac event, and it can discriminate risk between low, medium, and high. And the long-term health outcome is that it would, if used effectively, reduce sudden cardiac death events, improve appropriate ICD use, and reduce unnecessary ICD implants and complications. So this model, after it was published, we made it available online for healthcare providers to use through our website, and most recently it was also developed as part of AHA's website. And it's implemented, or it's a part of clinical practice guideline recommendations as well for AHA, as well as Canadian Cardiovascular Society. So while the online tool is great in that it can be disseminated broadly, we also wanted to deliver this tool at point of care directly within the electronic medical records, and this is what we did. And we developed this tool with the help of funding from the Rogers Translation and Commercialization Committee. So that's how the tool looks like. It's embedded and integrated directly within the electronic health records. It's already live at SickKids within Epic, and it was developed as a third-party application. Now, we also want to not just develop the tool, but ensure that it can be adopted across different effectively and efficiently across different settings, such as organizations within clinics and among different healthcare providers, and then ultimately sustained over time. And this doesn't happen organically, but very often, but what helps is implementation science. So implementation science can be used as a bridge between research and practice to ensure that evidence-based interventions are effectively integrated into real-world settings. And so with this study, we are using the active implementation framework, which is a staged implementation approach. So the first stage is really an exploratory stage where we're evaluating the need and among other things, between settings such as organizations and healthcare providers. So this was done ahead of the study and as we were applying for funding. The next stage is the installation phase, where we develop the tool, integrate it within the electronic health records at various sites, and also test the usability of the tool to make sure that it is functioning accordingly and satisfactory to its users, and then subsequently then launch it within the electronic health record systems. We also then, during this stage, consent implementation teams. So these individuals are responsible to monitor the use of the tool as part of clinical practice workflows. And this is aided with the research staff who, with looking at the back end user statistics of the tool, as well as doing medical record reviews, is evaluating implementation outcomes such as adoption. So whether providers are using the tool, its penetration. So is it used in eligible patients, and is it being used with fidelity? So as intended, meaning, in the right time, at the right time, in the right patient, and if the score is appropriately being documented within the patient's clinical encounter. So at the end of this stage, we're also evaluating implementation facilitators and barriers using, by interviewing the implementation team using the consolidated framework for implementation research. And finally, the last stage is full implementation, where the tool is used as part of clinical practice. And we are evaluating the stages of implementation completion, so the time it took, resources and costs related to this, as well as sustainment by administering a survey to organizational leaders. And what's going to be delivered with this study is an implementation strategy that's really informed by implementation across sites, varying in geography, size, and structure. So we have 4 participating sites across Canada, and the study is funded by CAHR. And essentially, it'll deliver an evidence-based, patient-centered approach to sudden cardiac death prevention in childhood HCM. And ultimately, it will result in a roadmap for digital health solutions that can be accessible within healthcare systems. Thank you very much.